A sudden 10% spike in 2026 across certain Medicare plans has completely disrupted the livelihoods of millions of people enrolled in Medicare, and realistically, this is only going to continue to accelerate as we move forward into the future, ultimately impacting millions more people, again, enrolled in Medicare plans. However, is this going to impact everybody? Certainly not everybody, but it will continue to impact millions and millions of people that enroll in Medicare and rely on their Medicare coverages to cover the bulk of their medical necessities and their medical expenditures during their retirement, and they're probably living on a fixed income like Social Security, and that's going to be really tough when they continue to disrupt these plans in a massive way. Well, that's what I want to talk about for you here in this video, because we've seen some massive shifts just over the last couple of years, and 2026 is certainly no exception to the rule. We've seen a huge jump this year in 2026. Now, I'm going to explain all the details, and I also do have this article right here. I'm going to pop this up in just a second so you can see and read for yourself exactly what this is talking about. I'll pull out the key details within this report. It's actually very interesting, and exactly what is being talked about in this article that I'm going to pop up for you is consistent with what I've been talking about here on the channel in tons of videos going back the last, call it 6 months or so, going back to about September, October of last year, 2025. I've been talking about this and I've been saying this. Get ready, everybody. This is coming. It's going to happen. And sure enough, here we are, 2026, and we're seeing tons of people being disrupted in a massive way. And again, not necessarily a good thing. Anyway, let's pop this up right here, right now. Feel free to read through the details on this. But we're talking about forced disenrollment in Medicare Advantage plans. Now, does that sound like a shocker? No, it doesn't. Why? We've been talking about this for so long. Last year, again, for a few months at the end of the year, I was saying, get ready, everybody. We're going to see a massive amount of Medicare Advantage plans being discontinued or eliminated simply because they're not profitable anymore. And remember, these huge insurance providers that have these Medicare Advantage plans, which are Medicare-approved plans, are going to start discontinuing and eliminating a huge number of these plans across the country simply because they're not profitable anymore. Well, unfortunately, as you can see here in this article, from the years of 2018 through 2024, we saw about a 1% forced disenrollment rate, okay? So that's not too bad. And then in 2025, it jumped from 1% up to 6.9% of forced disenrollment. 2026, it jumped again to 10%. 1 out of every 10 people, 10% forced disenrollment with Medicare Advantage plans. That's not very good, right? So literally 1 in 10 people across the country that are on MA plans, Medicare Advantage plans, are literally being forced to remove themselves from the plan, or literally having the plan discontinued, forced disenrollment. In other words, your insurance provider reaches out and says, hi, hello, yeah, sorry, we're not offering your plan anymore. You got to find yourself a new plan, and whatever that happens to be. Now, here's the problem with that, is that when they do this, the people that are being forced off of these plans, they're probably in an area that doesn't have a whole lot of plan options. When somebody doesn't have a lot of plan options, they're forced into a plan that maybe does not cover them properly, maybe does not have the proper coverages, or maybe does not allow them to see the doctors that they need to go to the offices, the clinics, the hospital system. Maybe it does not have the prescription coverages that they need. Maybe the plan is way too expensive, okay? There's just a lot of things here that are piling up that are really forcing people into a nasty corner where they're literally painted into a corner and basically said, here, you've got these 3 options. You got to choose one of these, right? Not a good situation. Now, obviously, I just said 3 options as just an example here, but this is unfortunately something that's happening across the country where we're seeing so many of these plans being discontinued. Now, what's interesting about this as well, and I had a video about this, actually, I think I had maybe like 2 different videos talking about this because it was actually such a major issue. But back at the end of January, okay, so end of January this year, 2026, we heard out of CMS, the Centers for Medicare and Medicaid Services, that for the upcoming year, 2027, compensations and reimbursement rates are basically going to be flat. In other words, what that means is that these large insurers that offer these Medicare Advantage plans are basically going to have flat compensations, flat reimbursements in 2027. In other words, they're not paying more. Okay, long story short, what does that mean? We're going to see massive elimination of these plans yet again as we move into 2027. Now, to be fair, as I film this video right here, right now, we're still relatively early on in 2026. We've got a lot of time between now and 2027. So there's nothing to worry about right now. But point being is that when we roll into 2027, later on this year in 2026, as we get into the Medicare annual enrollment period, again, October 15th through December 7th, again, that's a very long time from right now, later on this year. But when we get into that time frame, we're going to clearly see how many plans are left, right? Who bit the dust because of this elimination within all of these massive amounts of Medicare Advantage plans that are being eliminated? Who is still around, as in which plans are still available, and what optionality do people have at that point? But I predict as of right now, based on what we're seeing with these reimbursements and compensations, based on the announcement out of CMS, we're going to see another huge discontinuation and elimination of tons of plans, counties, regions, states. I mean, we're going to see a lot of this restricting coming up again later this year when we get a lot more information on availability of these plans across the country. Now, again, I think it was in maybe January sometime. I'm not sure, maybe the end of January. I had a video out then as well where I was talking about the two largest Medicare Advantage plan providers, United Healthcare and Humana. Just between the two of them, in 2026, they've eliminated over 400 counties across the entire country. Now, to be fair, there are thousands and thousands and thousands of total counties in the United States, but they alone eliminated over 400 counties where they would be offering Medicare Advantage plans and coverages for people in those regions. That's nasty. Remember, that's just two of the largest providers of Medicare Advantage plans in and of themselves. Okay, so just between the two of those, by the way, United Healthcare and Humana, just between the two of them, they have about 14 plus million people enrolled in their Medicare Advantage plans. Remember, there's about 35 million people, give or take a little bit, people that are enrolled in Medicare Advantage plans. And just between the two of them, United Healthcare and Humana, they have about 14 plus million people on their Medicare Advantage plans. So that means across all of the other providers, the remaining roughly 21-ish million people are encompassed there. Point being is that these huge providers have the market share of these individuals that are out there. Well, we saw this again in late 2025, being prepared for 2026, that a lot of these huge providers are just getting rid of plans left and right because they're not profitable. Remember, unfortunately, with these big healthcare insurance providers, they are in it for profit, right? They're not a charity. They're not a nonprofit. They're not there to do, good, just good work for humanity as a whole. They're there to make money. That's all they're there for. They're there to make money. So if something is not profitable for them, they're going to remove themselves and they're going to eliminate access in that given area, okay? Anyway, we've seen some massive disruption within these Medicare plans, a lot of these plans being disrupted in a massive way. And again, forced disenrollment. Not like, hey, we're going to have this option, whatever. No, it's gone. Sorry, we don't have the plan anymore. It's discontinued. It's gone. We don't offer that, okay? Anyway, which, by the way, if at any given point you need help with Medicare, if you have questions on Medicare, if you need to enroll in Medicare, if you have questions on your current plan or you need help finding the right Medicare plan and or coverages for you and your personal needs, if you have a special enrollment period opening up for you, whatever the situation is, contact Chapter there. They've already helped thousands of you so far. Just this year, in the last year or so, actually it's more than a year by now, they've helped over 10,000 of you in this community have called that phone number. Again, thousands of people getting that necessarily help, saving over $2 million just in the last 1 year alone from calling that phone number there. Absolutely amazing stuff. And again, anybody on Medicare, no one in particular, I'm just saying everybody, if you're on Medicare, you can call that. Roughly 70 million people out there across the country on Medicare. You can call Chapter there. Again, you can read it for yourself. It says free Medicare help right there. Give them a call. Incredible. They've helped out a ton of you. And again, they have access to over 20,000 plans. They'll certainly take whatever time you need to talk through all the options, whatever it is that you need with your plan. And again, they're going to want to understand your 3 Ps. Your 3 Ps, the providers or prescribers, okay, doctors in other words. They want to know who those people are so you can still see those people. They want to know your prescriptions. What prescriptions are you taking so they can make sure that you get the proper coverages and, you're not paying too much out of pocket for that and everything like that. And then again, they're going to want to know your preferences. What other preferences do you have? They're going to ask you those questions because they want to know, okay? They're going to ask you some other details because they want to find you the best plan for your personal situation, and they'll go to work for you. You just sit back, relax on the phone, answer a few questions. They're going to do all the grunt work. Let them do all that. Seriously, let them do the heavy lifting. Let them do the grunt work. They're going to literally do it with a smile on their face. All of us are like, come on, Medicare, really? It's so confusing. It's so frustrating. It's so overwhelming. The advisors there, they love it. This is like their sandbox. They're like building sandcastles, essentially, metaphorically, right? They're doing it with a smile on their face. And all of us are sitting here like, man, Medicare is not fun, right? And they're like, please, give us more. We want more. We love this Medicare stuff. I don't know, whatever. Everybody's got their own thing, right? But they love this Medicare stuff. Anyway, they will take all the time that you need to help you out with that. Take advantage of that, totally free. Otherwise, please, if you're new here, please consider subscribing, 100% free. Big subscribe button down below. Please share the video, big share button down below. Otherwise, check out the well over 6,000 videos here on the channel in the video library. Enjoy your day. Until next time, take care. Have a good one. Hope this helps you. And I'll see you again soon in the very next video. I'll catch you later.